Good morning, everyone. Can you hear me? If you can hear me, please type in yes in the chat room. Okay. All right, welcome, everybody. Today is day 3 of the virtual internship with Dr. Jimmy Chang, and I will be the MC and co-host for today's class. I think we already did a lot of introduction before, so we don't have to go into further about who I am and who Dr. Chang is. I think everybody already is very familiar. So we can jump straight to class. This is the 3rd of the 4th class. And after this class is over, starting in a few months later, we're going to go into talking about his special formulas. Okay, so Dr. Chang, are you online right now?
Oh, yes, I am. Can you hear me now?
Can you take over the PowerPoint and share your screen, please? Your lecture notes?
I am already sharing it. Can you see it?
Okay, so can you share it again, please?
How about now?
Yeah, I see it now.
Okay.
So can everybody see his PowerPoint? Okay, all right, we're all set. Let's start the day, start the class, virtual internship number 3.
Number 2. This is the second one on 2022. And I'm going to talk about some very interesting cases. Hope you can all get something from it, okay? Welcome to the year of tiger. First case, kidney. Can you hear me? Hello? Tina?
Yes, we can all hear you.
Oh, okay, you better, okay, you can hear me, huh? Oh, the first case is about kidney. Some of those people are not already in yet, so, okay.
No, not yet. Only half of the class is here. So yeah. Do you want to start the class, or would you like to ask them any questions, the students, or you want to share anything about what happened today that was interesting in your clinic?
Okay, anybody have any question now? Okay. First case is the kidney. I add something to the original PowerPoint. We're going to teach you something about calculating the kidney function. It's very, very important. Okay, the first one. Actually, my treatment is not totally about kidney, but it works. That's very interesting, huh? Okay. Let me explain a little bit about the ear point, about the design of this point. You see, this area is the kidney. It's very, very important. If you cannot find the pulse is very deep and very scattered in the area, but you can clearly see there's a dot in here in the kidney. And also on the right ear, there's another bulb here. That's the kidney condition. And let me explain to you something. This guy has I check his pulse. The right twin is kind of deep and scattered. So I noticed something in his head. Then I go to the ear point. I see black spot, like here. That means this guy has some kind of an old injury on his head, but it's not the major point. The point is something else. You can see this here. Okay, let me do this. You can see here, this is the hip area. Hip area means that the back, he has some old injuries. So his pulse is like this, very scattered, no power. I wrote down here, everything is so negative. That means he's weak and not functioning. And this one I mentioned earlier, this is the kidney area, and he has a bump in there. That's the kidney. So his kidney is about 38%. And he told me that. I didn't know. I know something was wrong. And the creatinine is 1.85. This number is very important. Try to bear in mind creatinine is the evaluation number of the kidney function. I'm going to share with you a formula. You can easily calculate in your office that how much his kidney function has left. But majorly on his ear point, it's like this. I saw it with dark spots, so I believe it's blood stagnation. And here. When I do a line like this, that means deficient. Deficient means that the immune system is low. But then again, the color is light. I see when I take the pulse with my fingertips straight down, and I find a very forceful line at left one, that means the gallbladder. So look at here. Yeah, there's also some bulb here. That's the gallbladder. Okay, but anyway, he's not asking for it. His major concern is the joint injury pain, and kidney is my idea. I want to fix his kidney somehow because I don't like it. This is the number he gave me. I don't know the number, but I know something is wrong, deficiency about the kidney. Okay, so look at here. This bump here means kidney, and this little dot here is kidney. So if you do not know how to take the pulse, you can always see the kidney condition on the ear point. Sometimes people have kidney function low, this EGFR low, not necessarily a bump or blood stagnation. If you see this area, the kidney area is pale and white, that means there's not enough blood supply through the kidney. That will cause the kidney function to go down. That's a different kind of treatment. But in this case, I decided to use blood movers for everything, such as I use 正骨紫金丹。正骨紫金丹 is for joint pain, for arthritis, for blood moving, and 乳香没药 is a good combination for all kind of blockage and pain. 普银 is for inflammatory pain and joint pain something. 生痛足浴汤 I use this very frequently for all kind of a stagnation and circulation and pain. So this is not directly pointing to the kidney function, but I believe it will work because there's a blood moving agent, this blood moving and also blood moving, but this one is anti-inflammatory. It goes everywhere. Puyin is the very interesting Chinese Taiwan herb. It's good for pain caused by inflammation, by swelling tissues, or by acute injury. So you should order this with this in your office all the time. So I put all this combination together. Okay, that's about it. Any questions so far?
Yeah, I have a question.
Sure.
Can you compare 正骨紫金丹 with 生痛足浴汤 for us?
Compare what?
Compare
Okay.
正骨紫金丹 and 生痛足浴汤. When would you choose that and versus the other one? What is the
Okay.
difference?
Good question. You're so smart.
What? Sorry.
Gu. Gu means bone. So remember this. Bone. Bone means arthritis for joint pain. Joint pain caused by from old injury or something, or old arthritis, anything with the blood stagnation. So remember this word gu means bone. And sen means body. Tong means pain. Zu means expel. Yu means blood stagnation. So sen tong zu yi tang is for whole body. you may say is for all the channels, all the pain, not necessarily on the joint, not knee joint pain, not finger pain, not elbow pain. It's for whole body stagnation and the pain. So a little bit different. So I always put them together, so you don't have to think too much. Just put them together. 乳香没药 is like a painkiller, and and 普银 is like anti-inflammatory painkiller. So put them together, it goes everywhere.
Okay, so 正骨紫金丹 usually is used for like trauma, broken bones. That's what we learn in school, So is it used immediately after like a trauma? So how long do you keep using this formula? It's no problem. You know what I mean? Like, for example, I broke my bone last week. I could take 正骨紫金丹. Last month, I could take 正骨紫金丹. But this patient obviously has a lot of dead blood, right? It's not an acute trauma. You can still use 正骨紫金丹?
Of course.
Okay, so long as there's this kind of bone-related type of pain or joint-related type of pain.
Yes.
Okay, so the next question somebody has is, what's the difference between 血府足浴汤 and 生痛足浴汤?
血府足浴汤 is the blood moving for upper part of the body. It's not for pain. It's just remove the blood, enhance the circulation, enhance your brain ability, enhance the circulation to the eyes, mouth, and everything, but not for pain. But 生痛足浴汤, 痛 means pain. Okay? So easy to remember. Learn some Chinese. And the next.
Okay, so the next question is 普银 sort of like astringent complex, but also can relieve pain?
Yes.
Okay, so for you guys who don't have the astringent complex, runs out of stock or whatever, you can use 普银 instead.
好了，还有问题吗？还有 questions? No?
Okay, any other questions? Let me see. Chief complaint. Oh, somebody asked earlier, you tell the patients to take 24 grams a day, right?
Yes.
It doesn't matter if they weigh 100 pounds, 300 pounds.
Of course, they're big and strong, not for kids or for skinny ladies.
So skinny ladies and kids, how many grams a day is best?
16 to 20.
So kids and skinny ladies like 100 pounds? Is that about what you're thinking?
20 grams.
100 pounds, 20 grams.
Yeah.
For every day?
And it depends on what kind of medicine you use. For blood moving stuff, don't use too much. For tonifying, you can use a little bit more.
Okay, so for blood moving like this one, how many grams are you telling them to take a day?
24.
So I thought you said don't use too much.
Not for the weak lady, for skinny lady. For this big guy, this is it's not very big, but he's strong.
Okay, so most of Dr. Chang's patients were Asians before, Chinese, but now more Mexicans, right?
Yeah,
and Armenians.
So I have a lot of truck drivers coming in.
Truck drivers? Interesting. So if your patients are mostly white who have never taken any herbs, probably you don't need to start out that high, because I noticed for my white patients, you don't need that much. They already respond. But the people who have taken herbs before, you need to use a higher dose.
I don't care. I just tell them to take three times and 3 full spoonfuls.
So 3 full spoons 3 times a day. That's not 24 grams, Dr. Chang. That's about 1 full spoon is about 1.5 to 2 grams. So if you're taking 3, that would be about 6 grams times 3, anywhere from 15 to 20 grams. Anyway, so the range is 15 to 24, okay? It's just up to you how severe the patient is. And if they already show good effect, they can reduce the dose. And somebody also asked, how much do you charge for 150 grams? And how much do you charge for consultation?
I do not answer that kind of question.
Okay, so if you want to know, you guys, you book an appointment. Okay. Any other questions? Okay, this one. How is 倒地蜈蚣 and 鸡香藤 different from 普银?
No time for that. We've got a lot of class to do. Okay, the next time, this guy is getting better. The kidney is about it's about 41%. So it's 3% better. That's very important. It is very good. It's very difficult if he doesn't even get worse. That's very, very important. Now it's 33%. That's what he told me after the examination. The medicine I'm giving him, not too much blood moving. I give him some kind of 右归丸. 右归丸 is for kidney yang tonification. Sometimes it's also good for sex hormone, thyroid hormone, for the sex energy for men and women. 阁下足浴汤 get this diaphragm. This means diaphragm. 下 means under it. 足 means expel. 瘀 means stagnation. So that's for the middle jaw. I use the 阁下足浴汤 to clean the blood stagnation in the middle jaw. The guy asked, somebody asked for a 血府足浴汤 is for upper jaw. Okay? And 6 C's. The content of 6 C's will be explained later. And 6 G's is for kidney yang too. So I'm gonna push more blood through his kidney. And Huang Qi is for energy, for everything. Huang Qi is very, very important for the energy and the kidney and stuff. Okay, that's the most important step. Clear the dead blood first and tonify the back afterwards. Okay. Oh, this is the final treatment. We must say thanks to Tina because they import this herb, 优盾草. 优盾草 is for all kind of a cancer, kidney failure, and all the urination problem, but majorly is for kidney. The 优盾草 is a very unique Taiwan herb. I don't think you can get it anywhere except Tina. And the 2 stone, why the 2 stone? 2 stone is this 20汤, 10 虚 means stone. Huh? This 2 stone is also the blood moving agent. I still need to move something about his lower jaw, this back pain or something. And see, I am using and 益母草. Why do I use 益母草? Because I want to enhance the blood circulation in the kidney. 益 means good. 益母 means mother. Actually, this herb is especially for the lady to clear out their uterus, to clear the water out of the uterus, to clear the dead blood out of the uterus, especially after the period. But I also use it to clear the heat and the water retention inside the kidney. So put them all together, it's very, very good. But majorly it's the Yudun. You must have something in your clinic. Huh?
So Dr. Chang, when you just mentioned the 益母草, clearing water out of the uterus, what does that mean?
What do you mean? What does it mean?
Is it like those women, when the period comes, before it comes, their abdomen blows up like a balloon?
Yeah, something like that.
Is that water or is that qi stagnation?
Both. The good thing about the 益母草is it's good for water and blood stagnation, and not only for the uterus, but also for the inside. For the circulation of kidneys. So even if 益母草 in Chinese is good for mother, but it's not only for women, for men too. It's very, very good, especially for chubby women with little water retention, not only inside the uterus, but in the whole body. The water is, chubby and retaining water. You can take it after or before period. It can replace the 四物汤, 四物汤. Sutang is good for all the uterus and for female period problem. But Sutang is little bit too sticky. If the blood is not clear enough, it will cause more stagnation. But Yimusa won't. It's good for chubby, water retention women. Okay. Okay. Next one. Oh, the kidney function. Okay. This is very important. I added only today. Okay. The number is 140 minus H, okay, times body weight. But body weight has to be in kilograms, not in pounds, kilograms. And divided by 72 times creatinine number. Usually, people evaluate kidney function with this number. Urine nitrogen, N is nitrogen, but not necessarily. I use this creatinine, it's more accurate. Once the doctor in Taiwan, the Chinese military general hospital, the kidney in the kidney department, the doctor told everybody, if you can lower the creatinine number, you can give you can publish to all, international publishers. But I don't think it's that difficult. They can use, they have nothing to use, but they use steroids, very strong dose. We use Chinese medicine and some herbs, we can lower the creatinine. This is the only number in this formula that's the major factor. So try to remember this. So next time when you ask the patient to do a kidney function blood test, make sure they got this. One more time, 140 minus H times body weight, that's in kilogram, and divided by 72 times creatinine. So if this number reach over 3, 4, then this number will be like 10%. If it's under, if the result is under 15%, then this person is in a very dangerous condition. If it's in the answer is 10 or lower, then the dialysis may be inevitable. You know what I mean? 听懂了没有?
Yes.
Tina?
3 or 4, right?
When it reaches the creatinine, supposed to be 1.04 or something. When it goes higher to 3 or 4, the result may be 15%. That means kidney function, the clearance. If it's only 10 or lower, then maybe it's too late to save it. Okay, any questions?
Any questions?
听懂吗?
Everybody understand? He's wondering. Clear?
Wondering what? Just a simple formula. So most important number is this number. This is the major factor that changed the result. The result should be like a percentage. Better be over 20. If it's under 20, you gotta be very, very careful. Huh? Okay. No questions? Good.
Okay. No question. Oh, can Dr. Chang explain what 15% means?
The what?
Oh, he means, Lele, if it's lower than 15%, then the kidney function is no good. If it's less than 10, then probably will go to dialysis.
Yeah, absolutely.
So that number, whatever that number, after the equation should be 20 or over.
Yeah, better be like that.
So does that mean the higher the better?
Yeah, of course.